New data released by the American Academy of Pediatrics shows that more than 500,000 children in the U.S. have tested positive for the coronavirus. The association reported nearly 73,000 new child cases between August 27th and September 10th. That is a 15% increase in just over 2 weeks. And this comes as the number of cases in the U.S. passes 6.5 million. And a death toll, we have over 194,000 people. So for more on this, we want to bring in Pediatrician Dr. Dyan Hes. She's the founder of the Gramercy Pediatrics. Doctor, I suppose hearing that we're seeing sort of an increase in child cases just as school has started is not completely surprising?
No, because we're testing so many more kids. So many school districts required kids to get COVID testing before school started because they wanted to know what the prevalence is in their community. So when you start testing kids who we hadn't tested in March, April, May, you're going to get more positives for sure. Most of them are asymptomatic, but you are finding more positives. I actually had my first patient who is positive, and I have one patient who's quarantined, and they're actually both college-age students.
Wow. And as you know, Doctor, thousands of children returned to school over the last few weeks for in-person classes. It's sort of bittersweet. I look at my Instagram feed and I see all the parents who are proudly, everybody holds those little cardboard things where it says first day of school. And then you understand that this pandemic is still happening. So what do we know about how the virus could potentially spread in schools?
Well, we know that wearing masks definitely, definitely decreases the transmission, separating the kids at least 3 to 6 feet apart. We know good hand washing in the younger children. If the teachers are masked and wash their hands, you have to remember, and I keep on saying this, we had emergency daycare open the whole time in New York for first responders, and there were no outbreaks. And we've had schools now in Long Island that have been open, like some of the schools opened early because they've missed so much school, and that they're doing it successfully. They have hybrid schedules. They bring in half the school at once. So you have to be creative. Money has to be invested for sure. And I think money is the driving point, whether your school is going to be able to open or not, because if you don't have the funds to do this safely, you shouldn't be opening at all.
Doctor, I know we don't have a lot of time with you, so I'm going to do two questions in one.
Sure.
Do children look different? Are there different symptoms in children when it comes to COVID-19? And also, can you talk a little bit more about this multi-system inflammatory syndrome that we are seeing in children?
Sure. So most of the children that we're seeing are asymptomatic, honestly. We didn't really even know. Most of the doctors don't even know that they had COVID. They're only getting tested, and we're finding out. And the kids who we do see with COVID are having a mild flu-like illness. To be honest, I haven't seen dramatic MIS-C, but I don't work particularly in a hospital where you get those kids who come in this with this terrible syndrome. So this syndrome is predominantly affecting African American and Hispanics, and we don't know why. More than 70% of the cases are in those races. It is an inflammatory response to COVID. So it's almost like a overstimulation of the immune system, and they have fever. They have something. They have a response that's very almost like Kawasaki's disease that we talked about before. So they can have a rash, red eyes, swollen glands, diarrhea, stomach ache, everything that you can get with Kawasaki's disease. But what we're also seeing is that it's really affecting the heart. And the one thing that I would say in children is that we have to watch now for the kids who are having COVID, even the ones who have mild COVID, is how is this going to affect them later on? And there's a lot of talk now in the literature about how COVID is affecting children's heart and whether they can go back and play sports. So do you need a sports clearance? If you had a mild case, do you need sports clearance from a cardiologist to go back to sports? This is all TBD, to be determined, because we just don't have enough numbers to see.
Really scary. Dr. Dyan Hes, thank you as always for providing some clarity on a subject that I think a lot of people still aren't taking seriously. We appreciate it.
Thank you.